So in Canada, the upfront treatment for transplant-ineligible newly diagnosed patients is primarily lenalidomide and dexamethasone. Certainly there'd be a smaller population that would get Velcade, melphalan, and prednisone, and another population that would get Cybor-D, cyclophosphamide, Velcade, and dexamethasone. So the SWOG S0777 study looked at the standard treatment of lenalidomide and dexamethasone in this older population that's transplant-ineligible but newly diagnosed, and compared that to the addition of Velcade to the backbone of Revlimid and dexamethasone. This is a quite impressive follow-up data at 7 years, and the median overall survival has actually not yet been reached in the experimental arm with Velcade, Revlimid, and dexamethasone versus about 69 months for the Revlimid and dexamethasone arm. It's quite profound in this transplant-ineligible newly diagnosed population, and hopefully becomes a standard of care as we already use Velcade and Revlimid in our everyday treatment practice for multiple myeloma. Well, neuropathy is certainly an important safety signal that we see with Velcade. Interestingly, in this study, because it's a little bit older, it's still used twice a week Velcade as opposed to just once a week, which would be the standard of care in Canada. And hopefully if we adopt that practice and if this upfront treatment becomes available, we'd see those rates of neuropathy decrease. I would definitely expect to see the trend of increased progression-free survival and hopefully at some point overall survival, although it's not yet reached. Hopefully that continues for quite a while yet. It definitely shows that the triplet backbone is the way to go in upfront treatment. And I think we've all shown that in the majority of patients we'd like to use a triplet. This seems to be a very efficacious and safe treatment to use in this elderly population. There would be a subset of patients that would be better with just lenalidomide and dexamethasone, but certainly the majority of treatment or patients would benefit from this triplet. The Maya trial, which will be read out on Tuesday, is a late-breaking abstract, which combines daratumumab to Revlimid and dexamethasone. Certainly is a very hotly anticipated new trial that we would hope at some point would become the standard of care for patients in Canada.